just want to draw attention to the arrival of President Cyril Ramaphosa in the Eastern Cape town of Umtata. We are watching what we believe is his motorcade arriving in that community, which has been ravished, of course, by flooding earlier this week, claiming so far 78 lives. The real concerns, of course, that number may very well grow over the next couple of hours. The president's arrival is preceded by that of the Cooperative Governance Minister, Velenkosini Hlabisa, who's been in that area for about 48 hours now, alongside his basic education counterpart in Sivuyo Kwahube. We're told that so far 4 pupils are still missing in the wake of the devastation caused in the main by a cut-off low that swept through the country in the main, and of course had adverse effects in places like the Eastern Cape and KwaZulu-Natal, where we saw gale force winds, in some instances uprooting trees, breaking down power lines, ripping off roofs from homes, and in the Eastern Cape, flooding at least one river in Umtata that has swept away a 22-seater scholar bus or scholar transport vehicle with 13 people on board. And of course, this is the kind of situation that really has attracted government officials both at a provincial and national level, including, of course, in the highest office in the land, that of the president, who we understand is arriving now. We're going to stay on these visuals as we also try to unpack just the impact of what's taken place so far. Government saying 21 of the bodies recovered in the Eastern Cape, in fact, have been identified so far. And that's largely because of what's taken place, the widespread flooding, the devastation. The death toll there now stands at 78. Cooperative Governance Minister Velenkosini Hlabisa classifying the province now as a state of disaster. He's also announced that post-mortems have been done on 49 of the bodies so far. Let's speak more about the toll of the tragedy, at least on health facilities, with the Eastern Cape Health MEC, Ntandokazi Capa, who joins us now via our video link. MEC, thanks very much indeed for your time. Welcome to the SABC News channel. There have been reports in the past that, in fact, the province has struggled to accommodate the number of bodies that have been found in the wake of this flooding. Is there any credence to that?
Not at all. We've not been struggling at all. Remember, in our forensic unit, we do have one in Umtata, one in Solo. So if the Umtata one is full, then we can transfer, we can use the one in Solo. So for now, we're fine. We're not struggling at all.
All right, that's good to hear, I suppose, under the circumstances. So far, 78 bodies being found, MEC. I wonder if you have any kind of updated figure around the death toll so far, and if you can get us a sense of how many of these bodies, to your knowledge, have now been identified.
Thank you very much. 30 bodies have been taken by their families already. At the forensic, now we are left with the balance, but the 30 has been identified and taken by the 4 bodies. The one that are with us, it's not that they are not identified. They are not. It's not unknown bodies, but the families have not yet come in to identify. But those who came in were able to identify who are these people. But we are still waiting in terms of procedure, waiting for the families to come and identify families. But we are sure by the end of today, all of that will be done. We've done all the autopsy for all the bodies. We are only left with the one that we found yesterday, the 8. They are busy doing it now as I'm talking to you this morning. So I am sure by 12 o'clock will be done. The only challenge that we had was an issue of water, but the municipality has assisted us, and now we are able to work at the forensic.
All right. What do you mean by the issue of water? Was there an outage that was caused by these floods?
Yes, there is a challenge of water in Umtata. If you heard the mayor speaking earlier in this channel, they're saying there was an outage of water across the KSD. So our facilities and even forensic was affected. As a result, there was a little bit of a delay yesterday in viewing the bodies. We managed to do the post-mortem for all the bodies, but the challenge was to clean the area. But with the intervention of the district, they managed to bring one water cart to fill up our tanks so that we can continue. Even today, they've done that. So that's why we're able to continue with our work. But even in our facility, especially the Mtata General and the Nelson Mandela Academic Hospital, we do have challenge of water. But thanks to the municipality, they are prioritizing us, as well as the gift of the givers is filling up our reservoir. So we anticipate that we are going to be sorted in terms of water. But the reality is there's a challenge of water across the area.
Right. Are you able to speak to us, MEC, about the state of those who have been injured by these floods? I mean, how many people have rocked up at your facilities looking for this kind of help?
On the day of the incident, we had quite a number, but it was not a major injury. It was minor. We managed to see them, and then they went back home. We only had one who had a fracture. That one has been taken to our orthopedic hospital, which is Bedford. That's the only person that we are left with. Other than that, all of them, they went home. There were no major injuries during this period. Only one person that really needed to meet with our specialists in terms of orthopedic services.
Right. The post-mortems, some people might say, are taking place way quicker than expected, and I suppose this is a good thing for families who are desperate for closure, especially if their loved ones have been killed by this tragedy. But what information are you able to draw from those post-mortems, MEC, about what might have happened to these individuals?
I would not really give you that information yet, because we still need to meet with the president, we still need to meet the premier and give that information. But we have concluded we do have the information, but for now I'm unable to give it to you before we meet with our seniors, give them that report, rather than hearing it from the media. It's above my pay grade now. It have to be announced by the president and the premier on the details of that.
All right, fair enough. I imagine, of course, there are still some families who may have questions about their loved ones. I heard the Cooperative Governance Minister yesterday saying that, if their neighbors, for example, haven't seen some of the people they live with for a while, they must come forward. What's the message from the Health Department about essentially helping to identify the rest of these bodies that are yet to be assigned to their families?
For us as a department, we can gladly say our communities are really cooperating. Even yesterday, around about 12, the 46 bodies were identified already by the families. So we really appreciate that the communities are coming on board. We are only left with the ones that we got yesterday. But I'm sure, because I am not at the scene now, but I am sure families are there, because we have set an op center so that whoever wants to come in, they can come in and get some counseling before they go and view the bodies. And then after that, they get another counseling so that they are not traumatized. So we are really appreciating the cooperation from our communities. They are really coming forward.
Yeah, I appreciate that you're not able to really get us the details of these post-mortems, but are you able, MEC, to at least give us a breakdown of the demographics of those who have passed away, at least from what you've been able to see? And I'm asking this because we know that among those, of course, who may have been affected here are young children.
Definitely, they are young children, but I do not have that stats now because we are still consolidating, because we are preparing a report to give it to the president. But I'm able to say there were people that were found, there were males, there were females that we managed to do that, but we've already categorized, but we're still consolidating as we prepare to present to the president.
Okay.
We will definitely give, I don't want to give you an outbreak news. No. I'll wait for the president to give him that information, and then when he is engaging with you, he's able then to dwell much on the information.
All right. And insofar as the damage to your own infrastructure, how bad is it looking?
We are really affected. About 26 facilities that are affected across the province. We are still consolidating the information, but for now, what we can say, there is indeed a disruption of our services, especially around the KSD area, due to electricity issues and as well as water. But we do have contingency plans. We do have generators on standby. Even Gift of Givers has given us another generator, so we are able to work for now. But we won't be able to service the elective surgeries, for example, but we can able to do the emergencies. But then again, we said, because there are machines that we are using that consume a lot of electricity, so they cannot cope with the generators. Our helicopters generators are on standby. If there's anyone who needs to get an emergency service, we can airlift that particular person to Frey Hospital or Livingston. So we are on standby. Even our mobile clinics are on the ground. Even in the areas where there were people that are kept there, we have sent our teams. Those who are on chronic medicine, we've already got their information. We managed to draw that information from our system. We are distributing the medicine as I'm talking to you now. So indeed we are affected, but we're managing the situation. And we said if it continues for us not to have electricity and our generators are failing us, we'll be able to decant our patients to the neighboring areas, because there's district hospitals that are not affected by electricity. So we'll be able to decant our patients.
Okay, because that was going to be my next question. Have any patients so far had to be moved as a result of this flooding?
No, not yet. Not yet. The only hospital that had a challenge of water was in Ntandokazi. We said we'll decant those if there's a need, but they said they are managing the situation because they do have a generator. So they are managing the situation. If there's a need for that, we'll be able to decant. But so far, we are still sorted in terms of managing our patients in our facilities.
Yeah. This is, of course, happening in a context where MEC, let's face it, the Eastern Cape Health Department has had its fair share of challenges, let's call them, over the past couple of years. How worried are you, I beg your pardon, about how much of a backlog this will add to an already burdened system?
It's really taking us back, especially as a Department of Health, where we are struggling in terms of finances due to medical legals and the backlog that we have in terms of infrastructure. We do have a budget that we set aside for maintenance, but now it means we'll have to divert that money and the facility that we've identified and try and address in terms of the ones that are affected. But we are still waiting for the national. We're hoping that in terms of disaster, as the minister will come back and tape what's going to happen in the province, and together with the president, we're hoping that even Department of Health won't be spared in terms of getting an assistance in relation to making sure that our facilities are really assisted. Indeed, we do have a backlog in terms of infrastructure, and now the disasters are taking us back. Even in December, there were disasters, there were the facilities that were affected. So it's really taking us back as a province.
Yeah, the Eastern Cape Premier, beg your pardon, Oscar Mabuyane, admitting to the SABC earlier this week that, in fact, from where he's sitting, there simply isn't or aren't enough resources to deal with crises like this. I mean, he spoke, for example, of one helicopter being used to service the entire province. Is that an issue or a sentiment that you would echo as the health MEC of the province?
Definitely, it's what I'm sharing with the Premier, because as we've got so many facilities, we've got about 771 clinics, for example, but we have only 3 helicopters. One is centered at the OR Tambo district, which service the eastern part of the province, and we have one in Buffalo City, which is catering for the central part of the province, and you have one which is in Butterworth, serving in PE Gabeja, which is serving the western part of the province. So it is definitely not enough, knowing the vastness of the province. So it is indeed true that we do not have enough resources, especially for such a facility, and yet looking at our topography as the province, it's a service that will demand more for our communities.
Right. How are your staff coping with what's taking place over the past couple of days? We've also heard, of course, in instances where just on any other occasion, hospital staff feel overstretched.
They are definitely overstretched, and we want to commend the work that has been done by our staff, especially the one from the EMS, as well as the rescue teams from the department, and the assistance that we got from our neighboring province like KZN, through the Gift of the Givers and other NGOs. And again, they are affected, especially those who are in the forensic as well as EMS. We are planning that immediately, once this process has been concluded, we will definitely give them a debriefing in terms of counseling, so that they are able to cope. We understand the circumstances they are working under and the trauma that they are facing. So we are planning as a department to make sure that we give them that counseling. So they are really giving it all. As you said earlier, that we managed to do about 49 autopsies within less than 12 hours, which is quite commendable for our staff.
Right, Ntandokazi Capa, I know you also have to prepare to meet with the president who has now arrived in the Eastern Cape. So let me thank you for your time. Really do appreciate it. That there is the health MEC of the Eastern Cape, Ntandokazi Capa, helping us get a sense of the toll that this disaster has had, specifically on the health department. We know, of course, that many of the bodies that have been found have to go through that system in order for autopsies to be carried out and ultimately for families to come forward to identify their loved ones.